Are you experiencing back and leg pain with prolonged standing or walking, which is greatly relieved with sitting? Hey everyone, this is Dr. Zach Reed here, Performance Sport and Spine, and today's video will be addressing back and leg pain that's caused from lumbar stenosis. What we're talking about is your low back or lumbar spine, which is comprised of 5 bones called vertebrae. In between those bones are discs, and your spinal cord runs inside those bones and is protected in the spinal canal, which will be relevant later. So what does this condition feel like? Well, it's typically found in people over the age of 50. There may be back, buttock, or thigh pain, and the pain may rate down into your ankles or knees. The pain is worse with standing and walking, and relieved with sitting. You may also experience a feeling of heaviness in the legs or pins and needles. Night cramps is a very underappreciated symptom of this condition, as well as people may adopt a wide gait to help with balance. So what is causing your condition? If we look at this model right now, that spinal cord and those nerves are inside the spinal canal. And stenosis means narrowing. So over time, structures can press on those nerve and blood vessels, causing irritation and compression, which causes neurogenic claudication, which makes the symptoms in your legs. Now again, some people have the stenosis, but no pain. So lumbar stenosis is the changes in the structures. Neurogenic claudication is the leg symptoms. And this stenosis can affect the spinal canal in the middle, which usually affects both legs, or it can affect the neural foramina on the side, which affects just one nerve root and often leads to symptoms on just one leg. The most important thing conceptually is positions like standing extend or arch the spine, narrowing that canal, causing more compression potentially, and positions like sitting kind of flex or arch the back, opening up that canal and relieving pressure on the spinal cord. And this compression can be caused by a variety of structures such as bones, ligaments, and discs. And it's important to know this is a gradual thing over time, which is why it's more prevalent in older people. It takes years and decades for these changes to slowly matter. Also importantly to note, a large amount of people that have lumbar stenosis on imaging actually don't have symptoms. And we'll discuss this more in detail later. There's also a vascular condition that can present somewhat similar that we'll discuss later in the video. People often think, well, if the bone is compressing the nerve, why would I do an exercise because surgery is my only option? Your bones may not change, but your nerves can get better. And it's important to note there is no cure for this. This will probably just get worse and worse over time, so self-management and interventions is paramount. So now we'll discuss posture and day-to-day modifications. So the first thing you want to do is temporarily reduce walking and standing. However, walking to tolerance is still safe. Another option is to use a step in the kitchen to help elevate your foot and put your spine in a more comfortable position. And for walking, using hiking poles can help be in a more slouched position, or just gently kind of being a little bit bent over may help. And then while grocery shopping, you can actually bend over the shopping cart and use that to kind of stay in a more comfortable position. And this is actually called the shopping cart sign, and it's very indicative of lumbar stenosis. So now we'll go over some stretches and movements that can help decrease the irritation of those nerves. And the first set are all that you can do standing up or sitting, as this affects a more elderly group. And then the second set are ones that you require to lay down. So the first is just a standing march. Using one hand to brace against a wall or a pole, just pull one leg up as high as you can, and then the other. And again, as you pull your leg up, it kind of increases the flexion of your back, and it's going to open up that canal. Now again, if you can only bring your leg up a little bit, that's fine. And then over time, build up strength and try to go higher. But again, the higher you go, the more it's going to open up that canal in the back. So the assisted bend over. So grab a pole or a wall, and then with your feet kind of shoulder width apart, you're going to push your hips back and kind of lean your head through your shoulders, getting a nice stretch on your low back. Stand up with your hips, and then repeat this motion. If you feel a little too uncomfortable, you can get a little closer and just minimize the motion. And then as you get more comfortable, you can bring your feet farther back and use a stretch that way. It's important to tailor it to your current fitness and symptom level. Standing posterior pelvic tilt. So we're going to think of our pelvis as a cup, and we're going to tilt it backwards or pour the water out the back. And a good cue for that is to squeeze your abs and your glutes. So you should feel your pelvis kind of roll backwards and come forward. Another good cue is you can think of your belly button and your belt buckle, and you want to pull those together and then relax. Now this may be a little difficult initially, but with a little bit of practice, it can become second nature. So the seated stretch. In a seated position with your knees slightly bent, you're going to take your right hand and gently reach down to your left foot, come back to starting position, and then reach your left hand to your right foot. Again, this is something you want to start slow and then increase the range of motion gradually. You don't want to really pull at end range or force it. Again, as you feel tension in your low back, and put your spine in a position that decreases the nerve irritation. So the standing quad stretch. So with your hand against the wall, place the outside leg up onto a small step or chair, and you're going to stretch inside that front muscle. So we're going to roll that pelvis backwards and then lean forward until we get a nice tension. Now again, this is mild. Don't really pull hard out of end range. And again, you don't want to arch your back. That will just cause more compression. So again, roll that pelvis, feel some gentle tension, and then push through your hip forward, maintaining that neutral or slouch position. Don't arch backwards. So for the first stretch, it's going to be the knees to chest. So laying on the ground with your knees bent, we're going to pull our knees towards our chest to tolerance, and then come back and repeat. A regression would be, if this is too challenging, to just pull one leg towards your chest at a time, and then as the symptoms decrease and your fitness increases, you can progress to 2 legs. The floor press. So what we're going to do is press our back flat into the floor and then come up. So think of the arch. You're trying to flatten the arch by pressing your spine towards the floor. Hold it and then come back up. Again, flatten our back, hold for half a second, and then come up. Now I have more arch than normal, so you don't have to actually press into the floor per se, but the idea is just to push your spine down to the floor to tolerance. Supine rotation. So your arms straight with one leg straight and the other one bent. You're going to roll that leg over your side and then come back. And again, these are mild stretches initially, so we're not trying to crank hard. We're just kind of go as far as your body allows you and then return. And they should be dynamic. We're moving constantly. We're not holding any one position. And then you repeat on the opposite side. You may find that one side feels tighter, so you may have to reduce the range of motion and then progress a little slowly on the more symptomatic side. Supine posterior tilt. So laying on your back, we're going to roll our pelvis backwards. So again, we're going to squeeze our glutes or our abs, or we're going to pull our belly button to our imaginary belt buckle, and we're going to flatten our back relative to the floor. Again, slow and controlled, and start gradually. So the quadruped rock back. So on your hands and knees, using your hands, push back and let your back relax. Hold for half a second and come forward. And again, as you bring your back back, you want your back muscles to relax as much as possible. Don't let your back extend your arch. So again, our back is kind of passive and we're moving our body with our arms, not our back or our core. And again, over time, you may want to try to press a little bit more with your hands. Some people may find that a little wider knee placement gives them range of motion. You have to tinker with that because each person is different. So the banded cat camel. Now if this is too advanced, you can start without the band, but placing the band around your back, anchored with your hands to the floor. We're going to round our back up and then come back to neutral. Again, you don't want to arch or extend your spine because that can potentially decrease the canal. So we're going to round up towards the ceiling, squeezing our glutes, come back to neutral. Again, round your whole body, bring your chin down, hold, and then come back to neutral. And then now we'll discuss some exercises and rehab to help strengthen the back. So the first one is a suitcase carry. So with a light weight in one hand, walk down a hall, maintaining good spinal position. This helps improve load confidence in terms of carrying weight and helps stabilizing the spine. The second option is carrying weight in both hands. And again, this proves that your back is strong and gives you more confidence to move and carry things in day-to-day life. So grabbing 2 light weights, walk down the hall to tolerance, turn around, and come back. Again, remember to keep a neutral spine and don't let your back arch. As you fatigue, those erectors, those spinal muscles will probably have you lean back a little bit, so stop before that happens. So the seated deadlift is probably my favorite exercise for this condition because you can move a lot of weight in a very safe manner. So in a seated position with your knees bent, we're going to grab a light weight to start, bend over, and then lift with our butt and our back to a neutral position. Try very hard to not overextend or push our shoulders back. Sometimes it can help to put your hand on your back, use one arm to have a tactile cue. But again, the goal is to lift with your back and your butt to a neutral position, not extend. And then as you get stronger, more confident, increase the weight. So again, it proves to you that you can use your back in a safe manner and that lifting things heavy is not inherently bad. It's what your body can currently handle that matters. So now we're going to show you a great exercise that's safe using the exercise ball to help build strength in your low back. So in a kneeling position with our tummy on the ball, cross your arms, or you may want to have one arm for bracing. And we're going to slouch down to the floor. And then using our back, we're going to kind of come up to neutral and then hold. And the goal of this is to build endurance, not strength. So we're going to hold longer and longer and then rest. Make sure to come only to neutral and not overextend or arch the spine. And again, you may only be able to hold it for 5 seconds at first. That's fine. But the goal is to build endurance over time. So now we're talking about walking and cycling. Now it's absolutely safe to walk with this condition, but you're going to have to do less initially. The best way to do this is establish a baseline using some sort of stepometer to find out how many steps you can do without aggravating your symptoms. Once you've found that, you can gradually increase over time. A couple great substitutions are using a treadmill on a slight incline because you can lean over and help take tension off your back. Or again, using those hiking poles that we talked about earlier to help you be in a more slouched position. And then seated cycling is probably the best exercise for this because the very nature of the spine position in cycling is a position that takes compression off those nerves. And by doing the cycling, you can increase the blood flow to the areas to help healing, build confidence, and just maintain general human health, which is greatly going to impact this condition. So how do you know if you have this condition? We're going to cover some clinical criteria now. So the first one is the standing exertion test. In a standing position, if you extend or arch backwards at 30 seconds, does this reproduce your symptoms? Secondly, are you over the age of 60? Thirdly, does your pain increase with standing or walking? Fourth, does your pain be relieved by sitting? And then fifth, is your symptoms in your legs bilateral, or are both legs affected? Our spinal canal is shaped different, so some people have this trifile spinal canal where others have a round or oval. And about 7-10% of them at the L4 level have this trifile shape, which may indicate an increased likelihood for stenosis as there's less room in the spinal canal, therefore the compression is more likely. As for over-the-counter medication, NSAIDs have more evidence than acetaminophen or Tylenol. However, the small effect size for both, and no one should use them with any comorbidities or contraindications. So what's actually causing this irritation of the nerve? When we look at this image right here, you can see this nerve is a blue structure. And then this black thing is a small blood vessel that runs through the nerve. And the red stuff is the oxygenated blood that goes in, and then the blue stuff is the deoxygenated blood that runs out. Well, as these structures compress the nerve, they pinch that small artery. And so the blood flows in, but it can't flow out and starts to swell. If this goes on long enough, it starts to irritate and damage the nerve, which is causing your symptoms. Once the compression is relieved, the blood can flow through again, which is why sometimes these are transit, which is why standing hurts and sitting feels better. Imaging, prognosis, and risk factors. So there's no gold standard for lumbar stenosis. And there's lots of people that have radiographic lumbar stenosis with no symptoms. For instance, this paper found that people in their 50s, 64% of people had moderate to severe lumbar stenosis with no symptoms. And people in their 80s, 93% had moderate to severe stenosis with no symptoms, and only 17% had severe symptoms. Imaging should be used to confirm what the history and physical exam has already found. It can't diagnose the person in of itself. MRI and CT scans are the preferred choice, and for prognosis, this study found that at 3-year follow-ups, 1/3 of the people improved, 50% of the people stayed the same, and then 10 to 20% of the people got worse over time. And then risk factors are high BMI, diabetes, hypothyroidism, certain genes, and then age. And then now we're going to talk about the other vascular condition we talked about earlier. So this is vascular claudication caused by peripheral artery disease. So the arteries are getting smaller or blocked, decreasing the blood flow. This affects the legs. This is exertional leg pain, so both walking and cycling will make this worse. Again, the more you move or exercise, the more this condition affects you, and rest in any position helps. So there's no position aspects to this, and there's a diminished pulse in your lower extremity. The most important criteria for this condition is the ankle brachial pressure index. And if this number is less than 0.9, it's indicative of this condition. So surgery. So it turns out it's mixed like lots of other things. The most common is lumbar decompression by laminectomy. Now it's important to note that this decision should always be shared between the practitioner and the individual. It is pretty helpful in short term, but we need more evidence for long term in terms of quality studies. Now, if you have cauda equina symptoms such as urinary retention or fecal incontinence, rapid progressive muscle weakness, or degenerative spondylolisthesis, surgery is urgent and medically required. Thank you so much for watching our video on lumbar stenosis. We hope to give you some stretches and advice to help manage this condition on your own. If you did find the video helpful, please like the video and subscribe to our channel. And don't forget to check out our other videos.